Okay, good evening. Thanks for coming. Let me introduce you to the team at Airas. We're a group of engineers here at the University of Utah that are working to change the future of respiratory wellness.
I'm Mohammed Bajani.
I'm Asher Kimball.
And I'm Camden Moon. Now, let me ask you a question. Do you have to think about your breath? Well, I'm willing to bet that now you are. And that's the reality for over 40 million Americans that struggle with chronic respiratory illnesses. This leads to over 2 million of those going to the emergency room for treatment. That's why our mission at Airas is proactive management that empowers patients to breathe easier through our data-driven insight. Now, let's talk about the current standard of care. You have an attack. You're going to go into the hospital. They're going to give you some sort of medication, and it's always reactive. Now, there are so many factors that go into you having an attack. Environmental factors, such as pollen and air quality, which we're all very used to here in Salt Lake City. But there's also things like exercise that can be detected with wearable health devices like smartphones or smartwatches. That's why Airas is working to develop a tool that connects your personal health metrics to those environmental informations to give you personal insight into your risk for respiratory attack.
Now, what do these people really want? What does these patients that are affected by these problems really want? First of all, they want to live with peace of mind. They don't want to be in constant fear that they're going to have an episode or a flare-up or an episode or an attack, an asthma attack. They want personalized insight to learn from their own body. But mostly, they want an early warning. They don't want to get treatment after the fact that they just had an episode. And hence, the demand is very clear. People really want proactive management rather than reactive management. And hence, ladies and gentlemen, we are on the path to do something exactly like that. In the US currently, there are 25 million people that live with asthma and 16 million of them with COPD. When we combine these diseases, they cause over 145,000 deaths in the US alone. And if we're talking about worldwide, there are over 400 million people that are affected by this problem. But at the same time, if we shift from the technical part of it, if we look at the wearable device market, their guys are booming. They have exploded through the market with over 200 million users up to date worldwide and increasing by the minute. Hence, the question arises that if such wearable devices can measure your heart rate, your blood oxygen level, your oxygen saturation level, your activity levels, all of the following that fluctuate when a person may be in risk of having an attack, why can't we use the same metrics and actually help in preventing those respiratory attacks? And that's how Airas was built.
Introducing the Airas algorithm. Airas is the world's first AI-driven engine that predicts your risk for a respiratory attack in real time. Airas collects environmental factors based on your geological location, such as pollen count, air quality, humidity, and temperature, and combines this with your personal health metrics, such as heart rate, oxygen saturation, activity levels, and sleep quality. Airas then generates your own personalized risk factor index using our AI-driven core.
Now let's talk about our business model. It's very simple, but very scalable. The largest piece of value that we bring is this mobile application that we're developing. It's bringing in all of these factors to get you individual data, all for around $15.99 per month. This is very reasonable compared to other people in the market. We're working with several key partners, healthcare professionals here at the U, insurance companies, and smart device manufacturers to try and bring this cohesive picture together. Lastly, a key resource that's important for us to discuss is this data that we're collecting can be anonymized and used to help pursue future research innovations that will potentially help cure some of these diseases or treat them better.
Now, how are we gonna build this idea or bring this to adoption, bring it to really the market? We'll collaborate with wearable ecosystems such as Fitbit, Apple, or Samsung. We are also collaborating with university hospitals and respiratory clinics so we can test our AI model, pilot test it, and test that can it actually work in real-time world settings. We are also trying to build an Airas community. Through interactive challenges and quizzes, we could spread awareness of lung health, lung cancers.
There are existing respiratory wellness apps. Propel Health is an inhaler tracking app, a medication adherence app, but does not take into account environmental factors. Daily Breath does take into account environmental factors, but it does not track physiological data. Aerator tracks air quality but cannot predict an attack. Airas is different. We fuse environmental data with physiological and behavior data to create a proactive experience for each user. This enables us for an early preventative reaction or
Now let's talk about the market size. How big this market is, what could we earn from this? Currently, the respiratory wellness market or healthcare related to your chest and lungs is gonna exceed $10 billion by 2030. And if we're looking upon the wearable devices market, they have well exceeded over $60 billion till date. Now, Airas come at the intersection of both of these as we're using our AI algorithm, which is our market, which is the uniqueness that we bring, but we're also using the wearable devices from such collaborative companies to build that AI model or to help in preventing those respiratory attacks. Now, if we could just capture 1% of our targeted users, 1% of both of those markets, or combined markets, which roughly we could say if we get 400,000 subscribers, which we are aiming, we could generate about $30 million every year annually, which is a recurring revenue as it's a subscription model. Now, Cameron will tell you more about the market validation.
And something that's really interesting about Airas is that we're kind of in between two markets, and that's the smart medical device market and the smart inhaler market. So we're not quite a smart medical device, but there's a ton of growth in that field. And the same thing is happening in the smart inhaler market, that widespread adoption is happening, and there needs to be someone who can combine these two technologies, and that's where Airas comes in. Now, a little more specific of a market is the smartphone-based therapeutics. Now, again, we're not technically a therapeutic, but this market is showing a massive amount of growth that's projected from 2022 until 2027. Now is the time for us to get involved.
we're seeking $20,000 for our seed investment. This will help us to propel ourselves through the initial stages of developing our AI. Our breakdown is simple. 55% in AI and app development, 25% in piloting and partnerships, 20% in marketing, with an end goal of testing and piloting launches. Testing and pilot launch. Airas is more than a product. Join us at the Future of Respiratory Air Wellness. Join us at Airas.
Thank you.
What does your competition look like? Like, do you have any specific examples of people who are competing?
Yeah. So Pellet Health, Daily Breath, Aerator, they kind of do similar things, but they don't do everything. Like I kind of.
It's basically what Airas, you could understand in easy words, but a bit technical terms, it's an integrated asthma management ecosystem, you can understand. We're taking up already produced data, we're combining it with environmental factors, which does have an effect on people that have respiratory illness, and we're combining them to potentially predict any asthma attack. Yep.
What is your cost comparison to your competitors?
It's pretty similar. We kind of looked into like similar apps, like not exactly the same because nothing really exists, but like for example, things that track like menstruation. are priced very similarly.
One thing more that suggests Propeller Health is a smart inhaler company that builds smart inhalers. That they don't work on subscription models because when you buy a smart inhaler, their app comes with it. But that's just recorded data. That's just telling you how much medicine you have left in the pump and stuff like that. It's not giving us, or it doesn't have the predictive AI model that we are proposing.
Yeah, Propeller Health is just like a step tracker, but for your inhaler. And then they have a couple of instructional videos to kind of teach you how to do better compliance when taking your medication. Which something interesting is the majority of people who use an inhaler, 90% of them actually have horrible compliance, and they're not getting the medication properly or to the correct spot. As you can imagine, as you're inhaling, if you touch all those other mucous membranes, your tongue is a massive one that gets infected. So that's what their app's more for, but that would be the predicate device we're working on.
And such companies that are specifically targeting themselves on environmental factors have not very good rating because people are willing to just open a weather app rather than install another app. So the rating for Daily Breath right now it's 3.1 and Airata is 2.9.
Are you guys positioning yourself as creating a new market or trying to?
We're at the intersection of several markets. All these people, you can get your environmental data like we all can on our iPhone or Samsung or whatever, and you have a step tracker here. But there's one thing about patient compliance is if we can make it as easy as possible and streamline that, then that's what's great. So the markets are there, we're just combining everything.
So I guess my question is, if somebody asks what market you were in, what would you tell them?
Smartphone-based therapeutics, that's the closest thing. There is a specifically smart inhaler-based market, but that is more for a physical device, and their software is like a simple step tracker. So, but technically, it is also a medical device.
This is probably a naive question, but what really do you think stops smartphones, smart manufacturers such as Apple from just integrating this themselves so it's in their own ecosystem?
Fantastic question. Why haven't we already? It's a medical device, and so you have to go through the medical device pathway to do that. So you can't just, I mean, the software is relatively simple, but what's interesting is the AI-powered algorithm that's also taking in factors like your personal health metrics. And so if you think about companies like the Oura, right? They aren't owned by Apple, or Garmin, and all these other companies. So you can use potentially any of these apps or any of these technologies that can detect whatever metrics we're looking at and combine it all. So they have to figure out how to incorporate all this